Okay. Yes. Yeah, hello. Hello, everybody. Good evening, all. My name is Dr. Chalpathi. I'm gastroenterologist at KIMS Hospital, Visakhapatnam. So we are doing a series of public awareness lectures and activities to create awareness among general public about various problems that they face in related to stomach and liver disease. So this is being done because we are going through a difficult time, that is COVID, for last almost more than 1 year now. So we wanted to reach out to the public because many of the non-COVID patients, they are suffering, especially those with gastrointestinal problems, gastric problems, and stomach problems. They are not able to reach out to their doctors because of the fear of COVID. They are not stepping outside. So we are doing a series of lectures and public awareness activities so that they can get better knowledge about the gastrointestinal problems. So in this regard, this week we are doing about the understanding of about colonoscopy and endoscopy. So you all must have heard about these words, these tests, in fact, called endoscopy and colonoscopy. So they are tests as well as treatment in certain diseases. They are used to test. In certain diseases, they are used to treat the diseases. So not just medicine, sometimes even endoscopy and colonoscopy can be used to treat the diseases. So we are going to take up one by one, one after another. So first we'll talk about endoscopy. So whether it is endoscopy or colonoscopy, it is actually a long tube which is fitted with a camera and a lens, with which we can actually examine inside of the digestive system. So endoscopy, it is used to investigate and treat and look upon the digestive system, which is on the upper part, that is mouth, throat, food pipe, stomach, and the upper small intestine. So this is called upper digestive tract. So with endoscopy, we can see the upper digestive tract, mouth, throat, the food pipe in the chest, the stomach, and the upper small intestine. On the other side, colonoscopy, it's again a long tube. It is fitted with a camera. Again, it is passed from the anus from behind, and we'll look upon the lower digestive tract, that is predominantly the large intestine and a part of small intestine also, but predominantly large intestine, which is called colon. So that's why this name has come as colonoscopy. So when you meet your doctor, gastroenterologist, or a surgeon, or a physician, depending on your problems, we'll advise you to go for these tests, either to treat the diseases or to investigate the diseases. So when do you require endoscopy? So those who are having long-standing problems like pain in the stomach, pain in the chest, or burning sensation, they are not able to eat, swallow the food. If there is some vomiting, or sometimes there can be blood in the vomiting, the food may not go inside. So in all these situations, we recommend endoscopy. Some people who have burning and reflux of symptoms, regurgitation of food, belchings, if they're not getting better, they recommend endoscopy. And those who have bloating, gastric problem, those who are not able to eat or tolerate the food, there will be swelling in the stomach. So in all these situations, we recommend endoscopy. So how endoscopy is done? First of all, I would like to clarify to all my viewers that endoscopy is a painless procedure. So gone are those days when there was used to be a lot of pain, probably a lot of apprehension also because of these tests. But modern ages, the newer scopes, modern technologies, they are painless. So without any apprehension, please remove this from your mind. Endoscopy is not painful. So it hardly takes around 2 to 5 minutes. It is a simple office-based procedure. You can just walk in fasting and can get these tests done and then go home on the same day within few hours after discussing the reports with the doctor. So endoscopy is a tube which we pass through the stomach. Before that, we'll numb your throat, the mouth, so that there will not be any uncomfortable sensation. We'll pass it and put some air so that we can visualize the food pipe, the stomach, the intestine, everything. And we are going to identify the problematic area which is giving you problem. There can be problem in the throat, there can be problem in the food pipe, there can be problem in the stomach or intestine. There are various diseases. It can be an ulcer, it can be a cancer, it can be an infection, it can be acidity, it can be indigestion problem, there can be polyps, there can be a blood vessel which is bleeding. So a lot of things can be diagnosed with endoscopy. At the same time, as I told, endoscopy is also used for treatment of many diseases, especially when somebody is having bleeding. Some people come with bleeding through the mouth, through their vomiting. They just suddenly bleed. Or some people they can have black motion. The motion or stool gets very, very black. So in these situations, endoscopy is very helpful in treating diseases. So a small blood vessel from where it is oozing can be identified and that can be tackled by clips or laser or injection, whatever it is. So that is number one treatment. So endoscopy is used for treatment. Second thing is if we identify the problematic areas like ulcer or cancer or polyp, we are going to take small pieces of tissue that is called biopsy and then we'll send this to lab analysis. So once it goes into the lab analysis, it's going to confirm under the microscope what kind of disease it is. So whether it is a simple infection or an ulcer or it is a dangerous cancer. So all these things can be easily diagnosed on endoscopy and another procedure called biopsy. Sometimes the intestines or the food pipe or the stomach can get narrowed because of various problems. Then it can be opened up by using dilators or that can be opened up by putting stunts. Stunt is something like a metal stunt, it's like a meshwork which expands and opens up the wound. So endoscopy is used for treatment also. So another thing is some people, especially children, they can get with foreign body. That is, they when they are playing, they can put toys, they'll put coins, they'll put pins or hairpins, the sharp pins like that, needles, they ingest sometimes the button batteries behind the toys. So they will keep ingesting, but they don't know, they're very, very small. So they keep taking them regularly. They have a habit of putting it in the mouth and tasting it, and then suddenly they swallow. So they come frequently for endoscopy, and that those things, all these kind of foreign bodies can be removed with endoscopy by using a basket or a forceps like that. So all these procedures are done as treatment for endoscopy also. So after endoscopy, the doctor is going to discuss with you about the findings and write you some medications and appropriately follow-up advice will be given. So sometimes some chronic problems will be there, like recurrent pain will be there, sometimes GERD, that is reflux symptoms will be there. In these situations, endoscopy will guide for future treatment, whether it can be treated with medicines, whether it can be treated with endoscopy, or whether it can be treated with surgery sometimes, or further investigations, especially, it can be useful. Another thing where endoscopy is helpful in the treatment of a condition called eclasia cardia. So eclasia cardia is something like there will be a tight sphincter between the food pipe and the stomach. So the food is not allowed down into the stomach because it gets stuck here and it will be very tight. So it will not relax. So the food gets jammed and it gets stuck in the chest, and some people will have vomiting and regurgitation also. So this goes on for months to years. And now there are new endoscopic modalities called OM procedure. That is, endoscopically we can actually cut the sphincter, give an incision, everything from inside without any external cut or wound. And through endoscopy, we can actually treat these diseases. We'll open up the sphincter, cut it from inside, and then relax the sphincter, loosen it up, and then patient is able to swallow the food and water easily without any difficulty. So this is another advancement. So all these things are they happen just because there are a lot of advancements in endoscopy. We can treat as well as diagnose many diseases. So coming to colonoscopy. So again, as I said, colonoscopy is a camera that is fitted into a longer tube, and colonoscopy is done from the bottom, like through the anus. A tube is passed. More or less, it is painless. More or less, it is painless. But because of the apprehension, we usually gives mild sedation, like we give mild medicine to make the patient comfortable and make them sleep during the procedure. The procedure usually takes around 15 to 20 minutes, slightly longer than the endoscopy. Uh, so colonoscopy before colonoscopy, we usually give instructions. So before all these things, you should understand why a colonoscopy is actually indicated. So colonoscopy is indicated again in patients who have lot of bowel problems, especially they have irregularities in their bowel movements. It can be constipation, like they may not be able to pass stools for a while. It can be diarrhea, they may be passing stools in an excessive way, 5 times, 10 times like that per day. Sometimes there can be a blood in the stool. It can be mixed in the stool, chronic problem. Some people can have lower abdominal pain below the navel area. There can be a chronic abdominal pain. Some people will have weight loss. Some people will have loss of appetite. Some people present with just loss of blood and low hemoglobin. So, in all these situations, we tend to recommend colonoscopy. Another very important thing where we recommend colonoscopy is to actually screen cancers or screen polyps. So now we have enough evidence and enough data to say that colonoscopy is very useful to prevent colon cancers, cancers in the colon. So we can prevent. So just like mammography, just like ultrasound, just like X-ray, we have colonoscopy which can prevent colon cancers. So how it is possible? So now the recommendation is anybody who is beyond 45 years need a colonoscopy without even any symptom. So this is called screening colonoscopy because in certain areas, in certain population groups, in certain countries, this colon cancer, colorectal cancer, that is cancer in the large intestine and cancer in the rectum, it is very common even at a very younger age. So that starts from a small structures which are called polyps. So these polyps, they start slowly and they actually grow and they become cancer. So the premise, the idea is if we detect these cancers at a very small polyp stage, then we can actually prevent colon cancers by actually detecting this at a very early stage and then removing them just by colonoscopy. And mind you, these patients don't have symptoms at this stage. So that's why now colonoscopy is actually recommended at 45 years, even in patients without any symptoms, because all these polyps are very, very benign and asymptomatic. They don't have any symptoms. So they give a lot of time, few years, 3 years, 4 years, 5 years, for them to grow into a cancer. So instead of waiting for a cancer to happen, colonoscopy can detect these polyps at a very early stage, and a screening colonoscopy is done to detect all these kind of polyps and then remove them at a very early stage so that the future cancer is protected, thereby the life of the patient is saved. So screening colonoscopy is recommended, especially in certain countries. It is picking up in India also, and that is very safe and effective, and it is the best modality. So, having said that, we have talked about screening colonoscopy, we talked about polyps, we talked about cancers, we talked about abdominal pain, diarrhea, constipation, blood, etc. etc. So, for all these things to happen, patient has to drink a medicine, so which is called a preparation, colonoscopy preparation, a bowel preparation. So what does the patient get an advice from us? We will ask them to drink a quantity 2 to 4 liters of a laxative. It is not a simple laxative. There are different laxatives. They will be drinking from the night before till 3 to 4 hours before the procedure in small sips in divided fashion. So by that, actually, with this preparation, 2 to 4 liters of preparation, they are going to pass loose stools till they are very clear. So the idea is you have to prepare the colon and clean the colon so thoroughly that we can detect even small problems in the colon, which is very important. So these small polyps or tiny ulcers or small bleeding points or small cancers, all these things can be detected if the preparation, that is colonoscopy preparation, is perfect and clean. So this is very important. So talk to your doctor, talk to your nurse. All of them, they will give an advice about colonoscopy preparation and an incomplete colonoscopy preparation. Like whenever sometimes we see colons are very poorly prepared, there's still lots of stool and motion in the colon. It is not cleared or cleaned. So it is very difficult for us to diagnose. So please follow the instructions how to drink this preparation and get prepared for colonoscopy. So again, what will we do in colonoscopy? We'll ask the patient to take this preparation, come fasting, and give mild sedation. It hardly lasts for around 20 minutes to 30 minutes, and after that, patient will be awake. It's a safe procedure, generally painless. And we detect certain things. We can detect fissures, we can detect piles, bawasir, we can detect fistulas, we can detect ulcers, we can detect a bleeding point, we can detect any kind of inflammation, we can detect polyps, small structures called polyps, and we can detect cancers also. So a lot of things can be diagnosed, and at the same time, whenever we find them, we take biopsies. Again, we send to the lab, we examine it under microscope, see what kind of disease it is, and that appropriately we give treatment. So similarly, if there is a bleeding point, we are going to clip it or do kind of laser treatment to control the blood bleeding spot. And if there is a polyp, we are going to take it out by a snare, by applying current and snare alternatively. We are going to pluck it out and then send this sample again to the pathology. This is called polypectomy procedure, and we can do it. At the same time, if we see cancers, we are going to take biopsies. If there is an ulcer, take biopsies. And depending on the disease, again, we're going to talk to the patient like, look, you have a colonoscopy done for so and so problem, and we found these things, and we have treated it like this, and this is the next plan, and these are the list of medications. So this is how we are going to explain to the patient. And if we send a biopsy, we are going to call the patient back to the office, and then we counsel them about future treatments, whether it is going to be treated with medicines or by colonoscopy, or sometimes they need a repeat colonoscopy, which is called surveillance colonoscopy. So, or sometimes we subject the patient for surgery. So, what is surveillance colonoscopy? So, sometimes if we see polyps, which are not even cancers, but if we see polyps, we are going to pluck them out by procedure called polypectomy, and we are going to send this sample for pathology in the lab analysis. So we are going to count whether it is a 1 polyp or 5 polyps or 10 polyps or 20 polyps, like that. And depending on the number of polyps and depending on the type of polyp, we are going to schedule or repeat the colonoscopy in 1 year or 3 years, 5 years, or 10 years. So it depends. We are going to stratify the patient, low risk or moderate risk or high risk, like that, and how they are going to have these problems in future. Sometimes these polyps can recur. They can keep coming back. So even if we remove now, they can keep coming in future. So these patients have to be followed 1 year, 3 year, or 5 year, or 10 year, depending on the risk stratification. We are going to schedule them for colonoscopy. Another important thing is if somebody in the family, especially the first degree, parents, kids, or siblings, brother, sister, like that, If they had a colon problem, especially colon cancer or rectal cancer or polyps, then we are going to do this at a very early stage and more strictly in this patient. Because if somebody is having a family history of these problems, then this patient is at a higher likelihood that they can have a colon problem again. So this is how we are going to, guide the patient and treat the patient, and this is how colonoscopy helps. So hope now you have a clear knowledge about endoscopy and colonoscopy. Uh, Indications: what is endoscopy, what is colonoscopy, why endoscopy is done, why colonoscopy is done, whether it is a diagnostic procedure or a treatment related procedure, what are the medications and how is the bowel preparation done, and how important bowel preparation is. And once you take a biopsy or a polyp out, then wait for the biopsy results, whether it is through endoscopy or colonoscopy. Talk to your doctor for further treatment. Check with them if just medicines are enough, or sometimes some kind of procedure through endoscopy needs to be done, like stunting procedure or bleeding control procedure or poem procedure for eclasia cardia, like that. And sometimes some people may need surgery also. So discuss with your doctors clearly with this knowledge, and I think that will help you a lot. Thank you so much. Be safe and be protected. Yeah, any questions? Okay. Then we can close, huh? Right. Thank you.